My name is Linda McCormick, and I'm a pediatrician at Carousel Pediatrics in Carrollton. At Carousel Pediatrics, we like to think of ourselves as one-stop shopping. We have a lot of special services that we offer here. We have a pretty much full-service lab on site. We can do a lot of tests that supplement our diagnosis and treatment plan. We also have X-ray capabilities, and most of the X-rays that we need to take, we can do and interpret ourselves here at Carousel Pediatrics. We have the capability to provide treatment for minor injuries. We can suture, and we also have the capability of splinting broken or sprained bones. We also provide some minor surgical procedures, such as infant circumcision and other minor surgical procedures like that. I think when someone comes into Carousel Pediatrics to be treated, they can expect to be treated with respect. And we strive to treat everybody the same. From the time that they enter the office and interact with the office staff, from that to going to be checked in by the nurse, to be seen by the doctor, no matter which doctor they see or if they see our nurse practitioner, I think that we strive to treat everyone the same, regardless of their insurance status, regardless of who they are or where they come from. Every patient that enters the door at Carousel Pediatrics can be expected to be treated with respect. My favorite thing about my job is, and it sounds trite, but it's the children. I love treating children because when they're sick, they let you know that they're sick. But when they're well, when they get better, you do what you can do to treat them and they get better, then they're happy. They don't dwell on their illness. They don't mope around. They get better when you provide them the appropriate treatment, and sometimes even when we don't. They get better on their own anyway. So that's the thing that I love about my job. I think that probably one of the most essential things involving patient care is to have communication and trust between the patients and the physicians. We are not only treating the patient in pediatric medicine, but we're also treating their family because we have to go through basically an interpreter. We have to talk to the parents and get them to understand and get them to trust what we're saying that they need to do to help their child be well. So I think that fostering a level of trust and good communication is essential to practicing pediatric medicine. And I think here at Carousel Pediatrics, we are able to do that. I think that we have a good rapport with our patients and with their parents, and we give a lot of education. We're big on handouts, and we like to give them a lot of information so that the parents, when they go home, can remember what we've talked about and can refer back to some of those materials that we give them. And we are always available as well after hours, weekends, or holidays, so that someone can return their call promptly, and we can continue that communication even after the office doors have closed. I think the thing that I most enjoy about treating patients is that I have the opportunity to intervene right from the very beginning. That's really the reason that I went into pediatrics in the first place. To start over at the nursery at Tanner Medical Center with a nice, fresh, clean, healthy body, and be able to educate the parents and work with the families and the patients to keep them well, to keep them healthy, and to watch them grow. I'm very interested in wellness, in fitness, in preventative medicine, so that we don't have to use medications to treat illness, so that we can prevent those illnesses from happening in the first place. And one of the things that I really enjoy about my job, and I've been here long enough to do it, is to have seen a patient in the nursery and do their college physical exam and send them out the door.